Hey everybody, this is Pamela, and this is the third time I've tried to do this video today, so I'm kind of getting frustrated. This is the last day of my 26th week of pregnancy, and since I did a little bit of a part one of week 26 very early in the week, I thought I'd do one now just to kind of tie up all what's happened this week and kind of give everybody a quick recap. Not that anything too eventful has happened. The baby's doing well, moving lots, although she doesn't want to move when I ask my husband to feel. She completely stops moving. Like I said before in my first video, doctor said she's doing well. Heartbeat was good and everything. As for the decision about changing what doctor I'm seeing, I haven't really made any big decisions on that right now because I'm still kind of at a standstill. We live in a very small town, very small group of doctors and gynecologists, so the whole thing is kind of not really going anywhere for me. But obviously, if I was to find something really negative about this doctor, I'm sure I could find another doctor if I had to. So I'm kind of leaving that on hold right now. So I just kind of want to tell you guys about how I've been feeling all week. Been feeling really crappy actually. I asked the doctor on Tuesday about the lower uterine pain and the low pelvic pain in between my legs, in the whole crotch area. And he said it's normal after you've had a few children. Muscles can get easily strained more and stuff like that since you've already had a few children. And this being my fourth, I guess I would fit into that category, wouldn't I? It's just over the last few days it's progressed terribly, the pain, especially the pain in between my legs. It's like this pain and aching and pressure. And it sometimes feels like a stabbing pain. It's terrible. And enough so that on Friday night I didn't sleep all night, and I actually contemplated going to the hospital yesterday morning because the pressure and pain was so bad. I was like awake all night. And it just doesn't go away. I even use like heating pad in between my legs and on my lower stomach, and it doesn't seem to do anything. Like I was pretty upset. Another thing I've noticed, I really don't think that I have a urinary tract or bladder infection because I just had my urine tested a few days ago and a couple weeks ago as well, and I don't feel any discomfort while peeing. And the urgency to pee isn't followed by me peeing 3 or 4 drops and then not being able to go. I always have to go pee. And I noticed that since this pregnancy has progressed, I've had to go to the bathroom 1 to 2 times a night to go pee. And now, like as of like Friday night, I had to get up like 6, 7 times in the night, and I had to do the same last night too. So it almost feels like the way I felt when I was like 38 weeks pregnant. It feels like the baby's big and heavy, and there's a lot of pressure down there. And it seems like even though I've just went pee, within 20 minutes, all the baby has to do is move, and I feel like if I don't get to the bathroom now, look out. It's like this terrible urgency to go, and I always have to go. So between the always having to pee and the pain, that was quite frustrating. But I decided instead of rushing up to the hospital and sitting there the whole day to be told, oh well, too bad, go home, I thought I'd just take it easy, and I did. And my husband pretty much took care of everything yesterday, which was really nice. Unfortunately, tomorrow when he's back at work and I'm working tomorrow, all bets are off and I'll have to do everything again. But I'll just take it one step at a time. Yeah, like it hurts so bad that even when I'm lifting one leg to put it in my pant leg, it hurts so bad between my legs. I feel like I'm going to cry. I don't know if any of you have ever experienced that, but this is my fourth pregnancy, and I've never felt anything like that before. And I've been reassured that thus far everything looks fine. But if I become really concerned, I can go see the doctor or go to the hospital. I just, like I would know when it was time to go to the hospital. I wouldn't just leave things until I was in some strange preterm labor or something like that. It's just, I'm very uncomfortable. And because of that, I'm finding that all the people around me, my close friends and family, are finding me less tolerable to be around. And I find it frustrating because nobody's really, quote unquote, coming down on me. I I know I'm being snappy and rude unnecessarily a lot of the time, but on the other hand, I feel like nobody gets me. I feel like nobody understands how I feel, and I feel like I just want to scream and go, please listen to me, I'm in agony, leave me alone, you know? But, hopefully things will settle down. I do when I rest and I don't do a lot of movement. It doesn't hurt nearly as much as when I'm up and walking around doing stuff. So, Hopefully if I pace myself and, take it one step at a time, things will be okay. But I'll finish this video up with leaving you with one note. I'm still looking for baby girl names, so any suggestions are very welcomed. And thank you to the YouTube user who sent me a very nice, long, in-depth, caring message. The YouTube user Mia0899CS, she sent me a really nice message telling me that I'm not crazy to feel that way, and sometimes people just don't click with their doctor, and it's my choice, which thank you very much for that. Um, anyway, have a good week, everybody. I'll probably do a quick week 27 update in the next couple days after I've begun my 27th week on Monday. So have a good rest of your weekend. Bye bye.